And we're happy to welcome back to Ebru today our medical expert, Dr. Vincent Eletto, and it's good to have you here.
Good to be here.
Now,
Thank you.
today we're going to be talking about heart attacks. Let's start off men versus women. Is there a difference?
Oh, there certainly is a difference. Heart attacks in women have increased over the years. In fact, it's the #1 killer in America.
#1 killer? I would thought it would have been breast cancer or something else.
Far surpasses breast cancer. Far surpasses breast cancer.
All right. What makes it different in women as opposed to men?
Well, I believe years ago we always felt in the medical profession that heart attacks were a male-dominated thing. We've since found out in the past 15, 20 years that that's not exactly true. Women seem to exhibit different symptoms than the men do. Classic symptoms being the chest pain, the feeling like someone is sitting on your chest, the sweating, the nausea, the vomiting. In women, it tends to be more palpitations, a feeling of uneasiness. They don't necessarily get chest pain. They perhaps get shortness of breath. The most common thing is that women say, I just don't feel good. I don't feel myself.
All right, what about the tingling in the arm sensation? That seems to be a classic indicator of a heart attack.
Yes, and that's because of the way the nerves supply the heart. The nerves above the diaphragm are intermingled like the Brooklyn Bridge, if you will. And that sends signals from different parts of the body. It's a referred pain, which is why not everyone gets the chest pain. They get the back pain, the jaw pain, the tooth pain.
You say that women will say, I don't feel good. My husband's going to say, you always say you don't feel good. Where's the line? When do you need to know what that line is to go to the hospital, to go to the doctor to get checked out?
When these symptoms begin to persist, when it's walking down the street, beginning to get these feelings, walking up the stairs, beginning to get these feelings.
And these feelings being pressure
tingling sensations.
If
you find that you rest, you stop, you sit down, it goes away. This is the warning signs that something bad is going to happen to you.
Now, I've heard that people can have heart attacks and not even realize it.
The silent heart attack, many diabetics get that because their nerves no longer function properly. That's absolutely correct.
And that's rare, though.
No, we do see it. We do see it, and it's the physician who sits there and picks apart that history that picks it up.
Well, what causes a heart attack?
It's plaque. It's usually narrowing of the vessels. It begins, some authors say, by age 15.
Really?
People begin to get plaque. That plaque builds up. It's made of cholesterol. It injures the blood cells. The blood cell then forms a cascade with platelets that forms the clot. Now you have an artery that's closed off.
How much is genetics? How much is what we're eating these days?
Oh my goodness, genetics plays the major role in this.
Genetics more than what we're eating?
Oh yes.
Really?
Yes. If your parents were young and they had heart disease, be very careful. Change your lifestyle. Look into being and eating healthy. Have regular exercise. Absolutely. This is something that you really have to focus on.
How does stress factor in? Because I've heard that many emergency rooms are filled with people thinking they're having a heart attack when really it's a panic attack.
Yes.
Do you see that?
Yes, we do. We see that often. However, the distinction between the two is very fine. Before any of us say that that's a panic attack, we have to make certain that everything is lined up and all the I's are dotted and the T's are crossed and we are not missing that MI. Stress plays a very high role. Stress due to our living conditions and stress due to our an illness perhaps will cause it.
What about rehabilitation? You have a heart attack. How do you recover?
Depends on what they've done for you. Depends on how many vessels were involved, if they stented you, if they actually did bypass surgery on you. Most people will, after a heart attack, have to be treated for depression. And once you get treated for that depression, your outlook becomes better. You're in physical rehab 5 days a week, perhaps.
Why is depression tied into a heart attack?
Oh, people feel that their life, a large part of their life is over. They've now had a heart attack. They feel
so they feel
almost,
like they're on borrowed time is what you're saying?
Yes. It's a good way of putting it.
But that's not necessarily the case.
No, though. It's not. We've done so many great, in the 25 years I've practiced medicine, we've gone from having basically 2 drugs to treat heart attacks to now we take you to the cath lab within 80 minutes of your heart attack. It's really revolutionized. And people are better off today than they were 25 years ago. Actually, life is much better now.
So, bottom line here, if you have a family history, make sure you're seeing your doctor, eating right, exercising, that's going to help. But genetics plays a role, so stay in touch with your doctor.
Major, and diabetics, hypertension, hypercholesterolemia, take care of it.
Right.
You'll live a much longer, happier life.
All right, well, Dr. Eletto, always a pleasure. We hope to see you soon here, not in the ER.